Hi, I'm Simon from Klara. At Klara, we have a big and ambitious vision and a big and ambitious mission, which is to transform communication in healthcare so all patients can receive great care. We believe that the future of healthcare is going to be good. It's going to be great. It's going to be amazing. The highest quality of care will be available at the lowest possible costs. Now, why is that going to happen? Technology is going to change everything. The exponential growth and application of technology in all the different layers of healthcare is going to fundamentally change how things are being consumed and being developed and being offered. We will see an exponential growth in the quality of healthcare and a radical decline in costs, so that great care is actually going to be available and affordable for everyone. So how is technology going to be applied to healthcare? And I was talking about the different layers of healthcare. What are these layers actually looking like? And we at Klara, we kind of have a very simple understanding of healthcare. We believe healthcare is a service consisting of two main elements and two main layers. The first one is procedures. So that's the actual hardcore clinical stuff, the surgeries, the appointments, the actual medical encounter itself. Now, everything else around it, prior to the appointment, prior to surgery, educating your patients, finding a doctor, scheduling appointments, after the surgery or the appointment, follow-ups, referring the patient to other providers, continuous care, and all of these things we kind of combine under the term communication. And that's basically where we want to play and what we want to transform. Now, before we go into communication, let's look at what's happening in terms of technology, because that's the big change bringer in the first part, in procedures. So in procedures, we see amazing things happening. We see here the Da Vinci surgical robot. It's a remote-controlled surgical robot, which actually operates on patients and is controlled by a surgeon. Of course, you can think about automating this, but this is pretty amazing stuff. But not only kind of in the surgery itself, but in diagnostics, we live in an age now where we have, DNA sequencing, genome analytics, to not only understand disease at a very kind of atomic level, but also to manipulate the very DNA itself through technologies like CRISPR. So this is pretty amazing too. Now, if you look at what's happening in the field of communication, the best picture I could find to kind of represent what's happening there and what the status quo is this. Right, 90%, and that's a real number, 90% of all doctors are still using fax machines as one of their predominant means of communication. Now, only 4% of patient complaints are coming from the actual care, the clinical side itself. And 96% of all patient complaints across the board are coming from kind of patient and customer service, where communication plays the biggest part. So this is one number, but to kind of show you how big the scale of the problem is, some numbers from the United States, where we actually operate in. $11 billion are wasted due to inefficient communication. There are $1.7 billion in malpractice costs coming from communication failure. An estimated number of 2,000 lives are lost specifically because of poor communication. And actually, 80% of all medical errors are stemming from the lack of communication during care transition. So this problem is really big, and it's real. Now, at the same time, something really interesting is happening on the patient side, as we're also moving into very interesting kind of generations now. 8 in 10 patients, that's 80%, are selecting their providers on convenience factors alone. That ranks higher than insurance coverage, bedside manner, brand reputation, or the actual quality of care itself. This is the #1 reason why patients in these generations are choosing doctors. Now, 9 in 10, that's 90% of patients, would leave their current provider if for one that offers a streamlined and comprehensive communications approach and technology. And again, 8 in 10 want to communicate with their doctor's office via text. And that makes a lot of sense because 99% of text messages are actually read. 90% of text messages are read within the first 3 minutes of being received. And if you compare this to other means of communication, which are, by the way, partly insecure, 33% is the open rate of emails in the healthcare space. Patient portals which are out there are used 30% or less. There are a lot of patients who have usages below 5%. So we at Klara, we ask ourselves the question constantly, how can it be that in 2019 we live in a world of robotic, remote-controlled surgery, of DNA sequencing and genome analytics, and technologies like CRISPR, where I still have to kind of call my doctor's office if I have a question or want to schedule an appointment, and I'm kind of caught up in a stupid phone tree. Now, this is what we want to transform and change, and where Klara comes in. Klara is a HIPAA-compliant messaging platform for medical practices to communicate with their patients, with other practices, with pharmacies, with labs, and with other medical professionals. We make it super easy for everyone involved in a patient journey to communicate in one place. We unify all the patient communication in one easy-to-use and comprehensive platform, and we simplify and we automate a lot of these workflows through applying intelligence tool on top of this messaging platform. So we surveyed our customers just recently, and here's some numbers I want to share with you guys. Number one, we save 3 hours per day for practices using Klara. Not having to be on the phone, but actually having everything in one place, messaging with their patients and each other. 92% of our customers tell us that Klara helps them to provide a great patient experience, which is becoming increasingly important. Now, 81% of our customers tell us that Klara helps their practice to run smoothly and efficiently by documenting and kind of unifying everything in one place. And one of the really exciting kind of numbers for me is that in the average Klara practice, 80% of their patients are on the system and are actively using Klara. So that's really transformative. Now, where were we as a company? We tripled our users, our usage, and also our revenue again last year. We are used by thousands of medical providers and hundreds of thousands of patients in 42 states in the United States only, across 40 different specialties. We have some of the best investors on board, which I'm super happy at. And together with them, we are on this big mission to transform communication in healthcare so that all patients can receive great care. And we do this by becoming the standard way of patients and providers to communicate and to exchange data. In the US, and then all around the world. Because where there's a phone, there will be Klara. Thank you very much.